Assalamualaikum and hi everyone. My name is JENGKA binti Uthman.
My name is Nursulazia binti Muhammad Afizi.
My name is Nur Balkis binti Muhammad Azmi.
My name is Muhammad Faris bin Ahmad Ruslan.
And we are from AS1205D.
Today we are going to present about our case study that we have conducted, which entitled
Survey on Common Knowledge of Asthma.
Among the students of University Technology Barat, UiTM JENGKA Pahang.
So, without further ado, let's roll it. So, what is asthma? Asthma is a common respiratory condition that can affect anyone, causing breathing difficulties and other symptoms. Knowing about asthma is crucial for effective management and support. At UiTM JENGKA, it's important to understand what students know about asthma to create a healthy and informed campus community. This study aims to explore what UiTM JENGKA students understand about asthma. We use online surveys and face-to-face interviews to dig into their awareness, find out if there are any misunderstanding, and see where students usually get their information. The goal is to use this insight to improve asthma awareness and support on campus.
why does this matter? Well, students are the future workforce and leaders in different fields. By understanding what they know and don't know about asthma, we can develop ways to fill in the gaps and create a more supportive community. This research is not just about academic knowledge, but it's about making a real impact on the well-being of UiTM JENGKA students.
We are approaching this study with a mix of health education, physiology, and communication studies to get a full picture of what students know about asthma. The results will help shape educational programs and improve the overall health support at UiTM JENGKA.
In the following sections, we'll outline exactly what we are trying to find out, explain how we did the study, share what we discovered, and talk about what it all means. This research is a step toward building a healthier and more informed campus community and adds to the larger conversation about health education in universities.
The primary objective of this study at UiTM JENGKA are twofold. Firstly, it aims to gauge the general understanding of asthma among students, encompassing its causes, symptoms, and preventive measures. These involve assessing how familiar students are with the various aspects of asthma. Secondly, the study intends to pinpoint and record prevalent misconceptions or misunderstandings that students might hold regarding asthma. By identifying these misconceptions, the study seeks to address and rectify any gaps in knowledge or erroneous belief about asthma among the student community at UiTM JENGKA.
In our asthma study, we talked to people who have asthma to understand how it affects their lives. We had friendly chats to learn about their challenges and how they deal with asthma every day. This helped us get personal stories and insight. We made sure to keep everything private and comfortable for the people we talked to. Now, we will look at what they shared to find out more about living with asthma and how people handle it.
Hello guys! So today we are going to interview
Some students in UiTM JENGKA
about their knowledge
on asthma.
Without further ado, let's go!
So, today this is our first respondent. So, what is your name?
My name is Afrina.
Okay, so my first question for Afrina is, can you explain what is asthma in the simple terms and give me one symptoms of asthma?
For me, asthma can make us hard to breathe, and one of the symptom is coughing.
That's correct. And another symptoms of asthma is like chest tightness and wheezing. Okay, so for the next question is, what can trigger asthma attacks in individual with asthma?
For me, I think exercise can trigger asthma attack.
Yes, that's absolutely right. Asthma attack also can be triggered by things like allergy or exposure to smoke. So for the last question is, how do you think doctors usually figure out if someone has asthma? Is it a lung function test or X-ray?
I think doctor usually use lung function test.
Yes, that's correct. Okay, Afrina, thank you for your time. So let's go to our next respondent. Bye!
So with me today is our second respondent. So I want to test you about your knowledge on asthma. So the first question is, what are some things people can do to prevent asthma attacks?
I think we should avoid any smoking environment.
Okay, you are absolutely correct. So Keeping a clean environment and staying away from known triggers are good preventive measures. So the second question is, are there any natural treatments that can help with asthma symptoms?
I think deep breathing.
Yes, correct. Practicing deep breathing can be a natural way to relieve asthma symptoms. It's important to discuss any natural remedies with a doctor. Okay, last question. What age do you think people develop asthma?
I think at any age, especially kids.
Yes, asthma can begin at any age, but it most often starts during childhood when your child's immune system is still developing.
Okay, so with me, here is our third respondent. How does asthma affect a person's daily life, including work, school, or physical activities?
Asthma can change daily life by making people miss work or school due to symptoms or appointments. Workplace or school triggers may cause asthma issues, affecting productivity or breaks. Doing physical activities may be limited because exercise can trigger symptoms. Socially, asthma might make people avoid some situation, causing stress. Working with healthcare pros for management helps reduce these impacts and makes life better for those with asthma.
Are there any specific challenge individuals with asthma commonly face?
People with asthma often have trouble avoiding things that make their breathing worse. Knowing what to do in emergencies and the extra challenges for parents or kids with asthma make it a lot to handle every day. Learning about asthma, getting support from doctors, and finding ways to manage these challenges can make life better for those with asthma.
Now let's go to our last respondents.
Okay, today with our last respondent about our asthma in our case study. Hello, can I ask you a few questions?
Yeah, sure.
Okay, it is about asthma. Okay, in your opinion, do individuals with asthma face social stigmas or misconceptions?
As I know, people who have asthma usually get depressed or get anxiety twice more than people who don't have asthma. Like people who's normal. So that's what I think, but I don't know, is it real or just misconception?
I see. I mean, it's your opinion about, but it's your opinion in your seat as a public. So I understand your answer.
Yeah.
So moving on to the next question. Are you aware of any lifestyle changes that can help manage the asthma patients?
For me, I think the most suitable lifestyle that you need if you have asthma is the healthier lifestyle.
Such as?
Eat good food, avoid cholesterol food.
You mean by having a good diet?
Yeah, good diets, avoid junk foods. You need to be relaxed a little bit. Like, if you don't really relax, you tend to have anxiety, depression.
You mean the panics?
Yeah, the panics. Short break.
Worsen the asthma.
Yeah.
I see. Okay, sir. Thank you for your opinion. And that's all for our last respondent. Moving on to the next slide. So we collected a total of 130 responses from the survey, 61 from male and 69 from the female. The question will follow through by the condition of themselves, whether they have asthma or not. 42 responses for yes and 88 responses for no. So we strengthen our research through the survey of what is a natural treatment that may help relieve asthma symptoms. It appears here that 119 responses answers to the practicing deep breathing exercise, while the other 4 and 6 answered the drinking caffeinated beverage and consuming high-fat food. Throughout our research, we also find out that asthma also have its own natural treatment, like drinking caffeinated water, like tea or coffee, inhaling essential oils like eucalyptus or lavender oils, or practicing breathing technique.
So for this question, it is about the symptom of asthma. The survey results from UiTM JENGKA students through Google Forms are in, and it is it is a success. Most recognize persistent cough as an asthma symptom, which shown our objective was accomplished. The graph shows that most students nailed the right answer, indicating they know that a persistent cough is a symptom of asthma. There is total 112 per 130 students got it right, and only a few students got it wrong. So we are optimistic that our video will do wonders in boosting their understanding. So there are many symptoms of asthma, but today I will present about a few symptoms of asthma, such as persistent coughing, shortness of breath, wheezing, and chest tightness. These things might sound simple, but they are critical for someone suffering from asthma. So let's go through these lessons together. So firstly, persistent cough is a asthma-related coughing and is a chronic symptom arising from inflammation of the airways. You know how when you get a cold, you develop a cough. For some people with asthma, it is like having a persistent cough, almost like a constant companion, and it's not a time occurrence, but it keeps repeating. This cough is particularly noticeable at night or in the early morning. Imagine having this cough even when you are not sick. That's what I mean by a persistent cough in asthma. Next is shortness of breath. Asthma can cause a constriction of the airways, leading to difficulty in breathing, especially during physical exertion or exposure to specific conditions. It's like trying to catch your breath after running, but for people with asthma, it happens even when they are not doing anything tiring. Then wheezing. Wheezing is the whistling or wheezing sound during breathing, particularly exhaling, is a common auditory sign of asthma. It indicates restricted airflow in the air passages and can vary in intensity depending on the severity of the condition. So last one is chest tightness. Individuals with asthma often experience a feeling of tightness or pressure in the chest, which is linked to inflammation and airway constriction. Let's move on to the next question. So this question is about the primary trigger for asthma attacks. Based on the graph, it showed positive results as 98 per 130 students got it right who chose exercise as the answer. There are few students got it wrong as they might be a bit confused about the answers. This showed that we had achieved our objective about the knowledge of students on asthma. Asthma attacks can be triggered by various factors, and the primary triggers typically include allergens, respiratory infection, and also exercise. So for allergens such as pollen, dust mites, mold spores, or pet denders, and certain foods may trigger an immune system response resulting in inflammation and narrowing of the airways in individuals with asthma. Next, respiratory infections such as the common cold or flu might worsen the symptoms of asthma by irritating the airways and increase the mucus production. Lastly, exercise. This physical exertion or exercise can induce asthma symptoms known as exercise-induced bronchoconstriction. It's essential for individuals with exercise-induced asthma to manage their condition to use appropriate preventive measures.
Next question. Among the respondents in the UiTM JENGKA student survey, 103 out of 130 correctly recognized maintaining a clean environment as a recommended preventive measure for asthma. However, some who answered differently might have misinterpreted the question or confused it with the option exposure to second-hand smoke. This confusion could have led to a discrepancy in responses. Nevertheless, the prevalent understanding among the majority of students regarding the significance of a clean environment in managing asthma triggers highlights a common awareness and knowledge base about preventive measures associated with the condition. So what are effective measures for managing asthma? Effective preventive measures for managing asthma encompass several key strategies. Firstly, maintaining a clean environment stands as a cornerstone in asthma management, as I said before, involving consistent efforts to reduce dust, mold, and other potential triggers within living spaces. Additionally, scheduled checkups with healthcare providers are pivotal, ensuring continuous monitoring of the condition and enabling timely adjustment in treatment plans if necessary. Moreover, identifying and avoiding specific allergens that trigger asthma symptoms such as pollen or pet dander play a crucial role in preventing exacerbations by minimizing exposure to known triggers. These preventive measures collectively contribute to better asthma control and reduce instances of symptomatic flare-ups.
The next question that we put in the Google form is about how asthma is typically diagnosed by healthcare professionals. Based on student UiTM JENGKA, most of them answer asthma is typically diagnosed by doing the lung function test. There are 111 of the students choose the answer, which gave 85.4% overall. However, there are 11 and 8 students answer asthma typically diagnosed by X-ray imaging and blood tests respectively, which gave the percentage of 8.5% and 6.2%. This is proven that asthma is typically diagnosed by lung function tests, when our survey got the highest vote for that answer. These lung function tests provide valuable information about airflow limitation, bronchodilator response, and airway inflammation, contributing to a comprehensive asthma diagnosis disease. Interpretation of the results is typically done in conjunction with clinical symptoms, medical history, and other relevant tests. It's essential for healthcare professionals to consider multiple factors when diagnosing and managing asthma in individual patients.
In conclusion, our survey on asthma knowledge among UiTM JENGKA students through Google Form show that most students know the basics well. This suggests that they have a good understanding of asthma. It's a positive sign that the education or awareness efforts in place are working and students are well informed about the respiratory condition. This emphasizes the need for ongoing health education to keep students informed at UiTM JENGKA.
So that's all from us. Thank you for lending your ears. Bye!